The divide inside the Republican Party is no longer theoretical. It is now playing out in real time on Capitol Hill. A group of centrist lawmakers is openly breaking ranks. They are siding with Democrats on a major health care vote. The move directly challenges party leadership, and it puts the future of Affordable Care Act subsidies at the center of a growing internal fight. This is not a symbolic rebellion. It is a legislative confrontation with real consequences for millions of Americans. Authorities on Capitol Hill say the issue centers on whether to extend federal subsidies that help lower and middle-income Americans afford health insurance under the Affordable Care Act. These subsidies, expanded during the pandemic, are scheduled to expire unless Congress acts. Without intervention, analysts warn premiums could rise sharply for many families, potentially pushing millions out of coverage. As the situation continues to develop, a bloc of Republican centrists has signaled they are prepared to vote with Democrats to keep those subsidies in place. According to multiple congressional sources, these lawmakers argue the policy is no longer just a partisan issue, but a practical one, affecting constituents in swing districts and states where healthcare costs remain a top concern. Leadership within the Republican conference has pushed back forcefully. Officials close to party leadership say the extension represents an unacceptable expansion of a health care law they have long opposed. They argue it would increase federal spending and further entrench the Affordable Care Act, a law many conservatives have spent years trying to dismantle or scale back. With the area now politically charged, the standoff has exposed deeper fractures inside the GOP. Moderates say voters are no longer interested in ideological purity tests when it comes to health care. Conservatives counter that crossing party lines weakens negotiating leverage and undermines broader efforts to reshape federal health policy. Beyond the immediate response, Democrats see an opportunity. Party leaders have welcomed the support, framing the bipartisan backing as proof that extending subsidies is both popular and necessary. They argue allowing the assistance to lapse would amount to a tax increase on working families and could destabilize insurance markets across the country. Policy experts note the stakes are significant. The enhanced subsidies have been credited with record enrollment on the ACA marketplaces. Letting them expire could reverse years of progress in reducing the number of uninsured Americans. Insurance providers are already preparing rate proposals for next year, and uncertainty in Congress could influence premium decisions long before a final vote is taken. As the situation continues to evolve, pressure is mounting on party leadership to decide how far it is willing to go to enforce unity. Some insiders warn of possible retaliation against defectors, including committee consequences or campaign funding challenges. Others caution that such moves could backfire, especially in districts where healthcare affordability is a decisive issue. Public reaction has been swift. Advocacy groups supporting expanded healthcare access are praising the centrists for what they call a pragmatic stand. Conservative organizations, meanwhile, are criticizing the move as a betrayal of core principles. Social media platforms are filled with debate, reflecting a broader national divide over the role of government in healthcare. Looking ahead, the legislative math remains delicate. Even with centrist support, Democrats still need to navigate procedural hurdles and timing constraints. Budget rules, expiration deadlines, and broader negotiations over government funding could all influence when and how the issue comes to a vote. International observers are also watching closely. Analysts say U.S. healthcare policy often shapes global discussions on access, affordability, and the balance between public and private systems. A bipartisan move to extend subsidies could signal a shift towards stabilization rather than repeal, at least in the near term. As lawmakers return to closed-door meetings and leadership scrambles to maintain control, the question is no longer whether internal divisions exist. The question is whether those divisions will redefine how healthcare legislation moves forward in a deeply polarized Congress, and whether this moment marks a turning point in the long battle over the Affordable Care Act